So my mom just had her lower All-on-4 done by you, and she's about to have her upper done. But one of the reasons she went and she interviewed multiple different groups that will say they might specialize in the All-on-4, the full mouth restoration. And just for those that don't know, that just means a full arch, a brand new set of teeth on 4 to 6 implants, right? And so so she went to see a lot of the ones you'll see on TV, and I went with her on those consultations. And she actually, not just because I had my work done by you, but also your skill level and just her confidence was blown away after she did that much more so here. But one of the things that really stood out that none of the other ones had was the material. And you know, you've gone through a progression. You've done so many of these that you've learned the process yourself of different materials and being a prosthodontist. And I believe you even did your thesis on ceramics. Am I correct?
Correct. And
so you have a real in-depth knowledge of what the teeth should be made of, which you don't really think much about that. And I heard, well, we've got hybrid acrylic and we've got zirconia, and everybody was saying that, and there was a time that's what you offered, but you found this amazing new material. Walk me through that. Why? And what's it called?
Okay, let's go to the history from the beginning.
Okay.
When it first started, it started what they call it hybrid denture. Hybrid denture, when we have titanium bar, and then you wrap around with some acrylic, and then acrylic teeth. So basically it's kind of fixed denture, because it's the same material of denture, plastic teeth, acrylic, but reinforced with titanium bar inside to make it strong. The problem with this one, because titanium and acrylic doesn't really bond chemically well together, so there is a lot of instances that would happen that the acrylic fracture from the titanium bar, and even if it didn't, by time that the acrylic burns down so fast, it's nature of acrylic, but that all what we had at that time. Because of all these problems, they came up with new solution, which is the Zirconia. Zirconia is fantastic material, very strong, but it's very strong. Too strong to the extent that it's not compatible with our human nature. It's not the same. Zirconia, if I can show you here, here's how the Zirconia looks like and how it sounds. So this is the Zirconia.
That sounds like 2 coffee cups.
Kind of. And actually by science, they said like within 5 years period, you have 1.5 million clacking or something like that.
So you bite down 1.5 million
in a period of 5 years. Like, I can't remember the number, I can't really be specific, but this is something like that. So imagine that you have this in your head all this time. Plus it's too heavy, right? And it's very solid. Our bone is not that solid. When you open your mouth so wide, what happens is like your ligaments and muscle flexes your jaw. When you have this in place, you lock this motion. So you keep your ligaments all the time under tension while you open. The effect doesn't appear right away, but down the road you might develop TMD, which is temporomandibular disorder.
TMJ, which most people know it as.
TMJ, okay, it's temporomandibular, fine, okay. But it's like the right name is TMD, okay. Temporomandibular disorders. So, plus it's, as you see here, very clacky. And our natural teeth is not glued inside the bone. Our natural teeth inside periodontal ligaments, which give us this shock absorber. When you bite hard, it has some give, right? Of course, the zirconia doesn't have that at all. So, this new science is hybrid nanotechnology. It had been in Europe for 15 years, but just recently in America for 2 years only.
Okay.
The reason why I found it, actually I didn't find it because I was very smart that I found it. No, I was facing problems. patient have this one and crack, and I have a lot of problems with patient have zirconia in their mouth, and for some reason it crack. Manufacturing problem, wrong chewing, whatever the reason is, but it's fractures, which is like blown out of my mind. Like what's going on here?
Because it's so strong, you wouldn't think, right?
It shouldn't, but it's brittle too, and very hard to deal with. It's very hard material. So I start to search, okay, what's alternative? I searched and make more research and visit the company over there, and I have this patient, and I ask him, you know what, we have this 3 failures of the zirconia that you break every time. Let's try this one. 3 times.
He broke the zirconia 3 times.
3 times. I don't know, like first of all, I said like maybe I did wrong impression. I did the impression and I remade it, broke again. Maybe the lab is bad, let me change the lab. It broke again. I mean, it was like, I'm done. I have to change something else. And actually the guy was very nice with me and he accepted to try this new material. Listen, I will try it with you. I don't know. I hear it's good. According to the research and according to all the data, looks fantastic. It's too good to be true, but let's try. The moment I put it in his mouth, I got the feedback. It's like, no, this is different. This is my teeth. So, okay, fine. I didn't take this one now, let's try it. Then I said like, you know what? Usually we put it and let him try it for a few weeks before we permanently seal it and close it. So that day, after 3 weeks, I was waiting for him to come to me with a fractured denture. Again, it's, if zirconia didn't take it, if zirconia didn't take it, this will take it. The guy said, like, how it's going? He was laughing. I really, like, how it feels. No, it's fantastic. Okay. Any issues? No, I'm eating everything. Everything. Yes, I'm eating everything I want to eat. No problems? No. I'm done. I'm fine. That encouraged me now to start to make another case. And at this point, I start to propose this treatment to my patients. You know, I have this and I have zirconia. And I have this one. I used to present many options, honestly, at the beginning. Because I don't know. I still didn't have long-term really feedback to judge. Almost a year now, more than 100 plus of XircOn Ultra. The feedback, nothing but awesome. Not one single problem.